I'm sure all of you know about VimoSewa's program as well as Mera Samant program, Annapurna's program, because both of them, both VimoSewa and Annapurna have been stalwarts in micro health insurance. From the time I was taking infant and baby steps, they had already established through VimoSewa and Uplift. Before it became fashionable to talk about micro health insurance, I think VimoSewa already had a small product and it was rolled out. And before the term mutuals came into all of our vocabulary, between Uplift and Annapurna, I think were one of the first organization which started working with Uplift in creating a mutual, and she has been, it started with Annapurna and then Uplift came, Annapurna was the first organization in the group of organizations of Uplift, and I guess even before Uplift was formally become an organization, Annapurna had already started on that journey of creating mutuals, health mutuals at that point in time. This I'm talking about 18 years ago, 20 years ago or beyond. So here we have both of them to tell us about why Seva being a Mahila bank and Annapurna starting off in SSG and going on into microfinance, why did they actually think about health insurance when the government had not even thought about micro health insurance at that point in time? And why did they choose to involve? Again, one of the key things that stands out in both the organizations is that they very closely work with the community and work with the community in designing the insurance product that they are providing to the community. So the first thing is, why did you choose on the path of micro health insurance, and why did you choose involving the time-consuming and difficult method of involving the community in the design of your product, and what were the challenges that you faced, and how did you overcome those challenges? Start.
So thank you very much, and happy to be here among many friends and fellow travelers. The first question was, how did we get into insurance in the first place? And actually, most of you know that Seva is a national trade union. It was set up in '72. It's registered as a trade union of informal women workers from the beginning. Started by Ilaben Bhatt right here in the city of Ahmedabad. And then as we went along, one of the first demands, and I don't need to tell an audience like you, was the need for integrated financial services. I'm talking the early 70s, 1972, and women, when they went banging on the doors of the nationalized banks, they were turned away and told they were bad risks and unbankable. And that's how Seva Bank started in 1974. And as Mukti rightly says, as we helped women save, take out loans, they said, okay, so we're saving. Seva has helped organize us into our union. We get minimum wages, we get more income, but we are sick all the time. So whatever we earn goes in doctor's bills and medicines. You've heard this all before. But one thing that really galvanized us into action was that we did a small survey in the 70s, mid-70s, around 77, of women who were not paying their loans back regularly, 500 women. And the major cause of non-payment was sickness. The other shocking finding was that 20 of the women who should have repaid their loans had died in urban Ahmedabad 1977, and out of those 20, 15 had died from causes related to childbirth. So this really forced our hand, and we began a community-based primary health care program, as many of you in this room would know. So as we went along with our primary health care program, women said, yes, prevention is fine, health education is all good, but what happens when we need to go to hospital? We don't have the money for it. We need that kind of financial protection. And that's really how the whole idea of insurance was born in the late 1970s. We approached Life Insurance Corporation. Yes, one other thing, women said that when we die, we don't even have money for our last rites and even for a shroud to cover our body, and we don't want to be a burden on our children. And so that's how we started talking to the Life Insurance Corporation, who I'm sorry to say initially turned us away, as did the other general insurance companies, saying women are bad risk. So that was in the 1970s. Then in 1992, again when we had a critical mass of 50,000 members in our union, that's when the insurance companies got interested, because as you all know, insurance is a numbers game. And that's when we started. In fact, day after tomorrow, we're celebrating 25 years of micro-insurance with, for and by women. And that's really how we got kick-started in 1992. Now the question is, why did you involve the community in designing and implementing? So, you know, like all of us, we work closely with people. We are a membership-based organization. I told you SEWA is a trade union. We take membership dues from our members annually. From SEWA was born VimoSewa, first as a unit, and as you'll see in a minute, then as a national cooperative. We have shareholders. We have 12,000 women shareholders. So naturally, if we are all by and for the women, so we have to start with them. They are the main decision makers. They are elected to our board, and they are on the board. They are the directors of our board, and so naturally they have to be involved in all aspects, including designing the products, designing the services, programs, tweaking, and so on. Second of all, as this is true for all of us, the program is for them, so obviously their inputs are critical. Without this, the entire thing would fall flat. The second point, the third point rather, is that our experience, rather than like Smita Ben had said in the earlier session, that women at the grassroots, and I'm sure you would agree with me, make the best designers. They are far-sighted, they're ready to take risks, they're ready to take responsibility and implement, and do so sincerely. And our 25-year journey, and still ticking, still going forward, is a testimony to this. And finally, the reason for involving the community is ideological, if you will, or value-based. Because of him. I can get it up.
The two big buttons?
Yeah, I'm pressing that, but it doesn't seem to be working.
Here.
Okay, I'll just get up and, because of this person.
I have a mouse here.
Okay.
There.
Yeah, because of him. This person drives our values. You've seen this before, you've heard it before. If you want to work, then have the poorest and the weakest in the center. So just reminding you of Gandhi's talisman.